Hello and welcome to our office. I'd like to share some information with you on how our clinic works. The doctor will be with you in a moment for your consultation. It's important that we learn as much about your case as possible. Therefore, the doctor will need the specifics about your condition, beginning with the most severe symptoms down to the least. This will include when the pain started, if you've had the same or a similar condition in the past, what makes it worse, and what makes it better. How often during the day does the pain occur? How long does it last? Is it better or worse in the morning or evening? Also, have you received treatment from any other doctor or used any self-remedy for this condition? What was that type of treatment, and did you get relief? We want to pinpoint the exact cause and make an accurate diagnosis of your condition. In this facility, we evaluate back pain cases and other severe conditions utilizing the latest technologies to assure excellent results. The doctor will first determine if you are a possible candidate for care. If so, you'll be placed on a specialized treatment program developed especially for you. We'll also discuss how good you can expect to feel and if any part of your condition could be permanent. We look forward to helping you on your road to recovery. I'll be back to speak with you again after the doctor has had an opportunity to meet with you. Meanwhile, we want you to know that your time and trust in us is very important. We promise to be both courteous and prompt. Don't hesitate to ask any questions of the doctor or staff about any of your needs or concerns. Hello again and welcome. Our clinic has one common purpose: to evaluate and treat debilitating cases of low back and leg pain with the state-of-the-art medical procedure known as non-surgical spinal decompression. We'll discuss how this procedure has revolutionized the treatment of low back and leg pain cases. We'll explain how the treatment works and if there are any possible restrictions. Why is low back pain such an epidemic? The activities of daily living, such as bending, twisting, lifting, sitting, pushing, and pulling by themselves, cause muscular and joint aches. In fact, overexertion accounts for 60% of all back pain. Other factors that cause back pain include injuries from automobiles, athletic, recreational, and occupational accidents. Back pain is the #2 reason for hospitalization, second only to pregnancy. More money is spent on back pain than any other healthcare condition. A report from the New England Journal of Medicine stated that 51% of all back surgeries are unnecessary, and statistics show that the long-term outcomes are not favorable for maintaining the patient's quality of life. The scientific research that led to the discovery of non-surgical spinal decompression is leading the way for the relief of back pain and a recovery for those suffering from it. It's truly a medical miracle. The Department of Neurosurgery and Radiology says spinal decompression should be utilized on all patients before surgery is undertaken. It's even proven effective for some types of failed back surgery. When you seek medical care, you want to feel confident that the treatment is going to relieve your symptoms and return you to the lifestyle you are accustomed to with lasting results. You may already have tried multiple types of treatments, such as harmful and addictive medications, epidural injections, and even surgery, only to get temporary relief. This is where non-surgical spinal decompression differs. It addresses the underlying cause of pain, relieving it, and aids in preventing its return. Anesthesiology News in March 2003 reported on the excellent results of a 4-year follow-up study on patients treated with non-surgical spinal decompression. The results indicated that after 4 years, 91% of the patients were still doing their normal daily activities, and 87% were either still working or had retired without back pain as the cause. The data from this study showed that the pain relief was not temporary, but appeared to improve with time. If you're viewing this and are suffering with back pain, we'll show you how to get back on the road to recovery today, and more importantly, how non-surgical spinal decompression helps in the healing of damaged tissue, encouraging a full recovery. In fact, let's discuss your case right now. The doctor performed an evaluation and scheduled this presentation so that you will know what to expect regarding your treatment. We've found that all too often, patients do not have a good understanding of their condition. As a result, they make a decision to either do nothing or agree to a treatment that is ill-suited for their condition, simply based on fear of the unknown. We want you to make your healthcare decisions based on knowledge instead of fear. This is your first step in taking the responsibility necessary for getting healthy. First, it's important to know how your back works. Normal, healthy spines are elastic and strong. Looking at them from the front or back, they should be straight and without curves. However, when you look at them from either side, they should have forward bending curves in the neck and low back, and backward bending curves in the mid-back and tailbone regions. These curves, along with the disc located between each vertebra, act like shock absorbers. The outer layers or rings of the disc run in opposite directions, like the plies on a radial tire. In the center of these rings, there is a hole filled with a thick jelly-like substance that acts like a sponge. Its purpose is to pull blood in and push blood out of the disc, keeping it hydrated. As long as these stay in the center of the disc, the pumping mechanism works. The shock absorber effect is maintained and the disc is healthy. Let's turn our attention to the cause of your condition and how non-surgical spinal decompression may be of benefit to you. As a result of your injury, one or more of the spinal joints with surrounding ligaments, muscles, connective tissue, blood vessels, and nerve tissue were damaged. The normal alignment of joint surfaces and integrity of the supporting tissue was altered. The spinal joints and torn tissue are no longer capable of handling the load, resulting in the pressure inside the shock absorbers reaching a critical level. The disc is pinched down, usually on one side, causing it to shoot toward the side or back. It begins to tear through the inside layers, causing inflammation and bulging on the outside. Remember the tire analogy? The air on the inside of a tire is under more pressure than the outside. When the plies tear and separate, the outside of the tire bulges, just like the disc. Traditionally, we would recommend surgery for these cases. However, we've learned that through research that the outcomes for most surgery cases are not favorable. Let me ask you, would you shave the bulge off of the outside of a tire and drive on it? Of course not. The thinning of the tire wall and friction would cause it to burst. This is what we see in most post-surgical cases, where lack of adequate screening leads to an inaccurate diagnosis. Other factors affecting your length or response to treatment are how many joints and other tissues were damaged and how much change has occurred in the spine. It only makes sense that the more disc and facet joints that are injured, the longer it will take to repair them. If you've waited so long that the space inside the spinal canal is now narrow, you have a condition called spinal stenosis. Non-surgical spinal decompression has been proven to relieve pain in these severe cases. The typical spinal decompression patient requires only 20 to 25 non-surgical decompression sessions. We will work with you to determine a schedule that will work the best for you. The doctor will reevaluate your progress every 2 to 3 weeks. Should you choose not to start on your road to recovery with non-invasive spinal decompression, and you've tried all other conventional treatments, surgery may be your last option. Let's discuss the 2 most common procedures for spinal surgery in very simplified terms. The first is a discectomy, which is an invasive procedure where a hole is made through the skin and the muscles in the back of the spine. A small device is then used to penetrate the outside layers of the muscle, and the bulging material on the outside of the disc is cut away, removing the compression on the nerve tissue. The second type of surgery is a laminectomy, which is more invasive. A larger incision is made through the spinal muscles and large ligaments in the middle of the back. Sections are then removed from each side of the vertebra, opening up the spinal canal. The bulging material is shaved off and the wound is closed. This creates more room in the spinal canal and reduces pressure from the nerve tissue. There is a high likelihood of infection, and the bone that is removed cannot be replaced. In both of these procedures, you will notice the disc was not repaired, nor will it ever be. Future options for these patients can be limited, depending on what was done in the operation. It's also important to note that surgery involves increased risk associated with general anesthesia, infection, hospitalization, lost time from work, not to mention a long period of post-surgical rehabilitation. Furthermore, studies have shown that 60% of all people who have back surgery will be candidates for repeat surgery after only 2 years. Spinal decompression therapy is different in that it relieves the pressure on the injured discs, creating a natural healing environment so your discs can heal. Finally, you can relieve your back pain and start living life to the fullest again. You'll regain your life and have much more energy. We want to thank you for watching. The doctor will be right with you.